All right, hello everybody. Today we will be talking about an overview on STDs and STI. So today we're going to be, our objective today is going to be discussing some of the most common sexually transmitted infections. We're going to be discussing risk reduction strategies and possibly discuss testing and community resources. Today I have a guest speaker, Rick, who is going to be explaining some of these things for us.
Hello,
Starting off,
everybody.
yes. Starting off with what is an STI?
An STI is an infection that can be transmitted through sexual contact with an infected individual, sometimes called sexually transmitted diseases or STDs. STIs can be transmitted many different ways, but most can be passed by vaginal sex, anal sex, oral sex, skin to skin contact, or mother to child, pregnancy and or breastfeeding.
Why are STIs important?
Well, STIs are important because about 20 million new infections each year in the United States are reported. More than 50% of all people will have an STI at some point in their lifetime. They often show no signs or symptoms. People are unaware of the infection and don't receive treatment. There's long term damage, and they may have passed infections to the others.
Are STIs curable?
Yes,
What kinds of curable?
chlamydia, gonorrhea, syphilis, and trichomoniasis, parasitic protozoan are all treatable by antibiotics.
Okay, and then what are some STIs that are not treatable?
HIV, herpes, human papillomavirus, and hepatitis B.
Okay. Can you get any kind of medication for that or
You can. They have medicine to help with people who have HIV or AIDS.
but it's not treatable?
It's not treatable. It just helps you live a happy life.
Okay. Now, starting off with the more specific kinds of STIs, what's chlamydia?
Chlamydia is the most commonly reported STI in the United States. 1.65 million new cases were reported in 2022. It's spread by vaginal, anal, or oral sex with somebody who has chlamydia. And again, you can pass that on by breastfeeding or while you're pregnant. They call it the clam or the gooey stuff.
Yes. And what are the symptoms of chlamydia?
The symptoms could be abnormal vaginal or penile discharge, burning sensation when urinating, rectal pain, discharge or bleeding, pain or swelling in both or one or both testicles, it's less common, or a sore throat.
What are the more long term symptoms?
It can lead to sterility or infertility, infection in the tube that carries sperm to or from the testicles, pain and or fever. Pelvic inflammatory disease is PID. Long-term abdominal, sorry,
It's fine.
pelvic pain, uh, scar tissue formation in the fallopian tubes, or ectopic pregnancy.
And then ectopic pregnancy is just in the fallopian tubes, if you weren't aware of that. And then now off to gonorrhea.
Neisseria gonorrhea, how do you say that? Gonorrhea is the second most commonly reported STI. It's spread pretty much the same way: vaginal, anal, or oral sex with someone who has gonorrhea, and a pregnant person can pass that along also. They call that the clap or the drip.
Yes. And then what are the symptoms of gonorrhea?
Gross.
Yes.
The possible symptoms could be painful or burning sensation when urinating, abnormal vaginal penile discharge, white, yellow, or green, rectal discharge, itching, soreness, or bleeding, vaginal bleeding between periods, or painful or swollen testicles, again, is less common. and a sore throat.
What are the more long-term symptoms of gonorrhea?
Sterility or infertility again, disseminated infection, a rash, arthritis, fever, meningitis, painful infection of the tubes attached to the testicles, pelvic inflammatory disease, scar tissue formation in the fallopian tubes, ectopic pregnancy, inability to get pregnant, and a long-term pelvic abdominal pain.
Okay, now moving on to syphilis. I know there can be a few types, but starting off with syphilis.
Syphilis is a bacterial infection caused by Treponema pallidum. In the United States, there are 203,500 reported cases in 2022. It spread direct skin contact with syphilis sore, a chantry, during vaginal, anal, or oral sex. It can include just skin to skin contact. And it can be spread from an infected pregnant person to the unborn baby. It occurs in stages as the primary, the secondary, the latent, and the tertiary. That's also known as the great imitator.
Yes. And when we start with primary syphilis, what do you see in that?
It's firm, round, and unusually painless. It's I don't know how you would say it, the chantry. It's just a syphilis sore. It appears within 2 to 6 weeks after exposure, usually, but can take up to 3 months. It's found on the part of the body that was exposed to the infection. It's usually the penis, the vagina, the anus, the lips, or the mouth. Often goes unnoticed or is misdiagnosed as something else. Typically disappears after a few weeks, even without treatment, but it still progresses to the next stage. This is the most contagious stage.
So going off to the next stage, the late tetary syphilis. What does that entail?
Um, they appear about 4 weeks after it heals. It's still contagious, especially in moist environments. Again, it goes away without treatment, but infection will progress. It's followed by a period of latency with no signs or symptoms. But with this, you'll have non-itchy rash with rough or red or reddish brown spots, alopecia or patchy hair loss, and then mucus patches, usually in the mouth, vagina, or anus.
I want to clarify that was secondary syphilis. I apologize. Moving on to the late syphilis.
Yes. This one typically occurs 10 to 30 years after the infection. It can damage almost any part of the body, including the heart, the brain, spinal cord, eyes, and the bones. It can result in mental illness, blindness, deafness, heart disease, and death. Uh, you can get a soft, gummy tumor called a gumma. Types of tertiary syphilis are the cardiovascular syphilis and late benign syphilis.
And then moving on to more specific areas that target syphilis, I'm starting off with the neurosyphilis.
Neurosyphilis can happen at any stage of syphilis. The neurosyphilis manifestations can also include hearing related, like very sudden hearing loss, ringing in the ears, vertigo. Eyesight related would be blurring vision, double vision, missing vision, or sharp eye pain at the back of the eye. And mentally related would be a headache that will not go away with medication, stroke-like symptoms, sudden confusion. If not treated properly, neurosyphilis can permanently damage the eyes, ears, or brain.
Okay, moving on to the congenital syphilis. What does that entail?
This is when a pregnant person passes syphilis to their unborn baby. In the United States, 3,755 cases were reported in 2022. An estimated 40% of pregnancies will result in miscarriage, stillbirth, or death soon after delivery. Transmission can occur during any stage of syphilis and during any trimester of pregnancy. It can cause premature labor, birth defects, Hutchinson's teeth, osteoporosis, chondritis, and developmental delays.
Okay, now moving on to HIV. What is HIV?
HIV is a human immunodeficiency virus. HIV is a virus that replicates inside the human body, so it must invade a healthy cell in the body to survive. In the United States, approximately 32,100 new infections occurred in 2021. HIV attacks specific cells in the immune system, the CD4 cells or T cells. If left untreated, HIV will lead to acquired immunodeficiency symptoms. Sorry,
You're fine.
acquired immunodeficiency syndrome. I always thought it was autoimmunodeficiency syndrome.
I thought so too,
Yeah.
but
That's what I always called it. But either
I'm
one,
wrong. Yeah.
either one is the same. You both get sick, and all it leads to an ultimately death due to severe opportunistic infection. There is no cure for HIV, but there are many treatment options available to prevent progression to AIDS.
How is HIV spread?
HIV is passed from person to person through the exchange of body fluids like blood, semen. This includes the preseminal fluid, vaginal fluid, rectal fluid, and breast milk. The most common ways to contract HIV is unprotected sex, whether it's anal, vaginal, or oral, with people living with HIV. Blood to blood contact, such as sharing needles, works, and exposure to HIV before or during birth or through breastfeeding.
What is the progression of HIV to AIDS?
Stage one would be an acute infection. The symptoms vary person to person, but some report having flu-like symptoms 2 to 4 weeks after exposure. The examples would be a fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Approximately 1.2 million people were living with HIV in the United States at the end of 2021. Of those, only about 87% knew their status. In stage two, it'd be a chronic infection. The virus is multiplying in the body. You'll show no signs or symptoms, but the virus is still passed from person to person. And then stage three, this is where it's AIDS. Without treatment, the virus will attack and weaken the immune system. Common symptoms often can be related to other illnesses. Examples include rapid weight loss, recurring fever or night sweats, extreme fatigue, prolonged swelling of the lymph glands in armpits, groin, neck, sores of the mouth, anus, genitals, diarrhea, pneumonia, etc. Diagnosed when CD4 count is less than 200 cells. An estimated 50 million people have died from AIDS-related illnesses since the start of the epidemic.
Okay, moving on to the next STI, which is trichomoniasis.
Okay, this is a protozoan parasite passed during sex. It's usually vaginal sex. There's estimated more than 2 million infections in 2018 nationwide. It's not a reportable disease, so the exact prevalence is unknown. There's an estimated 70% of infected people have no signs or symptoms. The possible symptoms they can come and go. It's itching, burning, redness, or soreness of the genitals, a burning with urination or ejaculation, thin discharge. It can be clear, white, yellowish, or greenish. Can produce unusual or foul smell. Infection usually occurs in the lower genital tract, the vulva, vagina, penis, or urethra. Greatly increases the risk of getting or spreading other STIs.
Moving on, what are genital herpes?
Genital herpes is the herpes simplex virus, HSV1 and HSV2. It's spread vaginal, oral, anal sex, or skin to skin contact with someone who has the virus. The symptoms would be one or more blisters on or around the genitals, rectum, or mouth. The blisters break and leave painful sores that take weeks to heal. Symptoms often referred to as having an outbreak, usually characterized by no or very mild symptoms. There is no cure for genital herpes. It's not a reportable disease, so the prevalence is unknown. There's an estimated 1 in 8 people aged 14 to 49 years are infected. Many have HSV and do not know it because they never had symptoms.
Okay, now moving on to the human I don't know how to say that.
The human papillomavirus.
There we go.
It's HPV.
Okay.
You can call it HPV for short.
Yes.
It's mainly transmitted through vaginal and anal sex, but can also occur through oral sex and regular skin to skin contact. Most people with HPV do not know that they're infected and they never develop symptoms or health problems. Vaccines are available to help prevent specific strains. It's recommended for males and females ages 9 to 45. There's no treatment for HPV, but there are treatments for the health problems that HPV causes, like genital warts, cervical, precancer, and other HPV related cancers. HPV is not a reportable disease, but it is common. Estimated 80% sexually active men and women will get at least one type of HPV at some point in their lives.
And then what is hepatitis?
There's hepatitis A, B, and C. So the hepatitis A virus, HAV, the vaccine available and recommended starting at age 1. It's more common in countries without modern sanitation. There's an estimated 11,500 new infections in 2021 nationwide. There was 43 acute HAV cases reported in West Virginia in 2021. So hepatitis B virus, the HBV, the vaccines available and recommended at birth also or anytime after. The leading cause for liver cancer. It's estimated 13,300 new infections in 2021 nationwide. There's an estimated 640,000 adults living with chronic HPV in the United States. So then you have hepatitis C, HCV. The medication to cure is now available, but currently there's no vaccine. It's the leading cause of liver transplants. There's estimated 69,800 new infections in 2021 nationwide. Estimated 2.2 million adults living with HCV in the United States.
And then what are some risk reduction strategies for STIs?
Well, number one would be abstinence from sex or abstinence from injection drugs. Never. Needles are bad.
Mm-hmm.
Yes. Mutual monogamy with a partner who is tested negative. That's also a good one. Reduced risk will be protected sex correctly and consistently. Fewer sexual partners, never sharing needles or works, take medication to prevent the new infections, and regular testings. HIV, STD is regular. Okay.
And then one last thing to go over is what is something we need to understand when using condoms as a preventative measure?
They're often condoms. They're called rubbers a lot of times. More than 98% effective when used correctly and consistently. Condoms come in a variety of shapes, sizes, colors, flavors. Condoms can be made of different materials. Latex is the most condom and most effective, most common. Non-latex would be like polyurethane or polyisoprene. Polyisoprene options for those with latex allergies. There's natural ones made of lambskin, but this does not protect against HIV or STIs.
And then I think that's where we're going to stop today. One thing I want to say about the condoms is make sure that you are washing your hands. It's just as important as wearing a condom because you can touch the secretion on the outside of the condom and contract an STI in the same way.
Yeah,
So
go-
just be very careful and understanding of that.
just like you said.
One thing, I hope everybody picked up one thing and is scared to get an STI because it is not something you want to contract, and it is a lot more common than we're being made aware of. So that is today's overview of sexually transmitted infections. Like I said, I hope everyone took something from this today, and thank you, Rick, for explaining this pamphlet with us today.
Of course.
We will see you next week on Monday from 4 to 5 and on Tuesday from 4 to 5 as well. Thank you so much.
Cut.